What's up, world? This is Adonis Taylor with New Wave Skate. Here to comment on video commentary from a urologist who is commenting on Johnny Knoxville's urethral injury. So I hope you enjoy my perspective, as I have had a severe injury dated almost 7.5 years now, going on 8 years. But I finally saw some relief at the beginning of this year, January 2025. So I think it's about time that I put a packaged video together, chop it all up, and give you my thoughts, comments, and feedback on what it's like to have a serious urethral injury.
Hey guys, Rena Malik, urologist and pelvic surgeon here. Welcome back to my channel. Today I'm going to be reacting to Johnny Knoxville's urethral injury. So one of you guys recommended this for me, and I found a couple clips where Johnny talks about his urethral injury on Variety and on Opie Radio. So let's watch, and I'll talk a little bit about what happened, why it happened, and what to do if you have an injury, what to expect, and all those sorts of things.
We were filming Matt Hoffman's tribute to Evel Knievel, and I decided, well, I want to have some fun too, and decided to try and backflip a motorcycle, but I can't ride a motorcycle that well.
Y'all, don't do that. If you don't know how to do something, learn how to do it. If you want to do a stunt, get trained how to do it. Please don't do these crazy things. You can really severely hurt yourself. And he's actually lucky that all he came out with was a urethral injury from this, because it could have been a lot worse.
Okay, so what the doctor just said there, I think is paramount, because I injured myself doing a trick that I hadn't done in probably well over 10, 12 years, which is an alley-oop porn star. That's the name of the trick, I think, for, you know, the sake of being politically correct. We call the trick now star grind, so it's an alley-oop star grind. But I purposely had not done that. I purposely tried that trick because it's a trick I used to have on lock, and for whatever reason, it was not as smooth as I thought. And it was a trick that I had also never done on a down rail. I've done it on ledges. I've done it on rails and ledges, but never had I done it with an incline, nor with a rail that has a dick at the end. So I think it's very important to note, when you're skating handicap rails and handrails that have that extra notch at the end, that you watch out and you be very careful. And again, don't do anything that you're not fully capable of doing. So skate within your limitations is what I'm getting at.
How come you don't wear a cup, at least, when you're wearing like some padding or anything?
I don't know. Feels like kind of cheating.
No one's going to know, though.
No one's going to know.
Yeah, it's not on the outside.
Yeah, I don't know. I mean, if I was thinking logically, I wouldn't have been doing that, you know?
Yeah, really important. Wear a cup and protect your junk. It's important.
Wear a cup and protect your junk. I have to chime in, because I found that wearing a cup from martial arts all the way to inline skating and aggressive skating is not ideal in most cases. It might be ideal in, I'll put it this way. The cup protects your junk, but what happens when you hit that cup so hard, right, that it smushes your junk? So I'm speaking from experience. I'm not speaking from hearsay and the land of make-believe. I have worn a cup when I first started aggressive inline skating. I wore a cup when I practiced martial arts, and what I found is that having the cup could make things worse, because take, for example, I hit one portion of my groin, only that portion of my groin may get injured. If I hit my groin with enough force and it's in a cup, now everything under that cup is getting squished. Think about that. Think about my hand as the cup and my groin and this other hand as the groin. If the cup gets smushed, everything in there is getting smushed or getting damaged. Whereas if I wasn't wearing a cup and I hit just a portion of the groin, only maybe the penis is getting injured, maybe one of the testicles is getting injured. So when they say, you know, wear a cup, I think if you're doing motocross and you're doing motorsports, I think maybe a cup is the way to go, because it's very high impact sports. But all of these things that we do are high impact, and you just never know. So I think to say yes or no to a cup is a very gray area. I personally found wearing a cup to be not only uncomfortable, but to be risky and dangerous because I have fallen using a cup and I've injured myself more. However, of course, the cup is going to protect. It's kind of like wearing a bulletproof vest. When you get shot, the bullet may still damage the vest and damage your soft tissue, but the bullet's not going to penetrate. So if I had to recommend wearing a cup versus not wearing a cup for the action sports like inline skating and skateboarding, I would say, I'm not saying yes and no. I'm just going to say what I would do is I would not wear a cup. But I think if you're not sure of your limitations, then by all means, go ahead and wear a cup. And if you're a young child, prepubescent, I would say absolutely go ahead and wear a cup. I should also note for the record that I am a former EMT basic, right? As opposed to an EMT advanced or an EMT paramedic. I was an EMT basic from 2004 to 2007 in New York State.
Whatever you do, do not ditch the bike right away, because if you go like this and ditch the bike, then it goes 40 feet in the air and lands on you.
Yeah. And on the fourth time, I come off the end of the ramp, let go of the bike, it launches 20-something feet in the air, and I fall back down on my back, and my knees are behind my ears. Like when I fall, I'm like, and right at that time, the motorcycle comes down and breaks its handlebars off of my crotch.
Oh, y'all, that is so painful looking. So that's called a straddle injury. And a straddle injury is when you have any sort of trauma to the groin when your thighs are spread open. And that can cause injury to the urethra, which is the tube where you pee from, the perineum, or what's affectionately referred to as the taint, or your pelvic bone. So straddle injuries typically happen to people when they're falling, off their bike seat onto the bar between the bike, or where you fall on something really hard. This is obviously a very unique way to get a straddle injury where a motorcycle falls on top of you just at that right location.
I stood up and I felt like I was peeing myself. Every time my heart would beat, blood would shoot out the end of my penis.
I injured the only body part that means anything to me.
So yes, that is a very unique straddle injury where the motorcycle handlebars fell on his groin area. For me specifically, what happened is that, as you can see in the video, I landed in a seated position with one leg raised, and my taint, my perineum is exactly where I hit, and my perineum pinched my urethra. So my urethra, my urethra was pinched between my pelvic bone and my perineum, if that makes any sense. So imagine a straddle injury means that you're straddling with two legs on either side, right? And straddle injuries are very common with equestrians who are riding horses, jockeys riding horses, because they're constantly straddling the horse. Motorcyclists, bicyclists, anyone hopping over a fence. Oftentimes people climbing and hopping over a fence will experience some sort of straddle injury, and it may not be as severe as what I've encountered, but these are just things I've learned from doing research for the last 6 to 8 years.
So it sounds like he has hematuria, and this is obviously due to a trauma, but there are a number of other causes of hematuria. I talk a little bit about them in my reaction to House, where they have a patient who comes in with hematuria, so you can check out that reaction video. But he has blood in the urine after a trauma, and that would absolutely require him to go to the emergency room. Typically what we do when you come to the emergency room after a trauma and have blood at the meatus, you undergo a workup for a urethral or bladder injury. So the first thing is a retrograde urethrogram. What ends up happening is you get put on a table, kind of frog leg, so that we can see the urethra really well, and then we inject some contrast into the urethra, and then you can see the different components of the urethra, the anterior urethra or the posterior urethra, as well as if it fills into the bladder, and you can determine where the injury is. The next thing of most importance is getting your bladder drained. And so whether that's with a suprapubic tube or a catheter that goes in from the skin into the bladder directly. And I mentioned that before on my reaction to Grey's Anatomy. I'll link that here as well. But a suprapubic tube is a way to put a catheter in through the abdomen and allows you to bypass the urethra. Or if you can get a catheter across the injury gently, that's okay as well. So those are usually the first two steps.
So yes, the hematuria, blood in the urine, that's one way to put it. I think the better way to put it from my experience is simply that I was bleeding internally and blood simply was a part of that process, right? So my urethra, from what the doctors had determined, it wasn't just split or spliced or cut because of the injury was so severe, and the urethrogram was very difficult to even get. They determined that my urethra had to have been, according to the medical reports, the terms that they used was ruptured, and in some areas they used the term lacerated, meaning it was a very, very, very bad injury.
Yeah, I had to go straight into surgery, and it was a tear in my urethra.
Oh my
God. And it was taped to my leg for 4 to 5 weeks, and I had a bag on my ankle that pee went in, and it sucked when you got erections because your penis was
taped.
It's
like the Incredible Hulk, right? It starts breaking out of this whole thing.
It was,
and it's green. It's bruised.
Yeah, and it's taped down at a right angle, so it's like very painful.
I've been through all of this, very painful stuff. So yes, getting the bladder drained, but the retrograde urethrogram was very important, and it was probably one of the most painful experiences I had to go through ever in my life. Physical pain. Prior to the retrograde urethrogram, I remember them asking me if I can urinate, and they needed me to try to urinate to test how severe the injury was, and just the thought of urinating sent bone-chilling and debilitating, nauseating, almost blackout pain throughout my body. And that was just the thought of urinating. So that's just to give you an idea of how much pain I was in.
So it sounds like he had a urethroplasty or repair of his urethral injury. And depending on where that is, typically if you look at the reported literature on straddle injuries, you'll find that most of them are in the anterior urethra, and typically the large majority can be repaired with just a primary anastomosis, where essentially you clean off the edges of the injured urethra and sew them back together, and then you do leave a catheter for some duration of time that can range from 2 to 4 weeks to allow that area to heal, and then you do another retrograde urethrogram after you remove the catheter to make sure it's healed correctly. It can be as short as 2 weeks or as long as 4 weeks where you have a catheter, and there are obviously trials and tribulations to having a catheter. It is secured to your leg because we don't want it to get pulled on or tugged on or ripped out, because that can create, one, a lot of discomfort, and two, it can damage the repair that you just recently had done. So we do secure it quite well. We try to secure it pretty loosely so that you can move around comfortably. I don't know that a lot of men are having erections with catheters, but maybe there are. Having a urethral injury is no walk in the park. So maybe wearing a cup would have saved this guy a lot of problems.
Urethroplasty is essentially when they recreate your urethra by taking a piece of tissue, soft tissue. Usually it's taken from the inside of the cheek. Mine was taken from the inside of my left cheek to recreate the urethra, but that was not done until a few years after I had gone through several procedures. So I came out of the ER I went into the ER and woke up with 2 catheters. One is a suprapubic, which is a hole directly into the bladder above the pelvic area, above the groin. And the other is a tube that's coming directly through the penis. The Foley catheter goes directly through the penis. I then was let go after I think about 3 or 4 days and was sent home. They kept the hole opening for the suprapubic catheter, but they kept it covered with gauze as an emergency means in case they needed to get access to that area. But they sent me home with just a Foley catheter. And with the Foley catheter, I kept that in for approximately 3 months. And in those 3 months, I would go to the ER every 4 weeks to get it taken out, removed, cleaned, and replaced with a fresh new Foley catheter. I should also note that yes, the penis does get taped and tied to the side of your leg to prevent yanking and tugging and to prevent further injury. It is very painful when there's an erection. However, I somehow managed to cope with it using drugs and alcohol, which I do not recommend anyone do, because I made matters worse for myself. And it's probably why it took me 6 to 8 years to finally get some relief and finally get the right help from the urologist.
How long were you laid up?
It was 4 or 5 weeks. I had to pee into a bag, and then I had a catheter twice a day for 3 years after that.
Twice a day for 3 years?
Yeah.
When did this happen, this thing?
That was in 2008, I think. And then for 3 years, twice, like a tube about...
Is that the only way you could piss? Was it
No,
with a catheter?
I could pee regular, but they didn't want the hole to close up, so...
So what would they
catheter
do?
in to keep it open.
Yeah,
Kinda
yeah.
like you
Just
putting-
bore it out.
It's like keeping in earrings so that your whole so they don't heal. Otherwise, your dick hole would have healed, and then you would it would have blown up like a balloon of piss and exploded. That's actually exactly what
happens.
Yeah.
That's exactly how the doctor put it to
Yeah,
me. Thank you.
Sure.
So you'd have to carry that on the road with you twice
Everywhere,
a day and do it.
everywhere, yeah.
So Johnny Knoxville says 4 or 5 weeks. So just keep that in perspective. I had mine in for what is it? For 12 weeks, and then I had initially I had the first emergency surgery, then I had surgery every 4 weeks to remove and take it out, or surgical procedure. I also had surgery to close the suprapubic hole. And then months went by, a year went by, I finally got an appointment for the urethroplasty. Urethroplasty went well. They put another catheter in. That stayed in for, I think, another 4 weeks, if not less. And then January 8th, 2025, I had another procedure known as a balloon dilation. And the balloon dilation has provided the most relief that I've had since 2018. So since 2018, I have not been able to urinate comfortably until January of this year, 2025.
So what he's describing is called clean intermittent catheterization. And typically it's done for patients who cannot urinate. So people who can't urinate for a variety of reasons. And you can learn more about urinary retention on my last reaction video on urinary retention. So what happens when you can't pee for some reason or the other, you can learn how to catheterize yourself by a nurse that's trained in catheterizing. And you can actually place a catheter in your urethra yourself that allows you to empty urine out of the bladder. This being done after urethroplasty, there's actually no great data on doing clean intermittent catheterization to keep strictures open. And particularly after urethroplasty, there's just not a lot of evidence-based data to support or negate doing this practice. So some people do routinely have their patients catheterized after urethral repairs to prevent recurrent stricture formation. And the timing of that, or how often you have to do it, is really unknown as well. Do you just do it every day, twice a day, once a week? We don't really know. So the only study I could find was one that was very small and that only looked at 126 patients, of which only 31 actually catheterized after repair of a urethra and 95 did not. And they found no difference in recurrence whether you catheterized or not. So based on that study, I don't typically do it. But again, it really depends on how things looked after his repair, where exactly his urethral injury was. And this might have been the best thing for him, because having a recurrent stricture is really, really challenging, and you want to get the best repair the first time you do surgery. So I hope Johnny Knoxville is doing great right now, and I think he stopped doing all these crazy stunts, but who really knows?
You say you're more fire than nigga, you a lie.
Thank you for watching, and I hope you stay safe as well. Peace, love, and blessings.